I think that researchers are working on better blood tests. Pretty much the 3 tests that we have are the blood test, the skin test, and the food challenge. All of them have pros and cons. I always say that the blood test and the skin test are not really diagnostic tests. They're tools to help us determine what the likelihood is that somebody would have a reaction if they were to eat the food. So they're not going to actually tell you if you actually have a food allergy. The only one that's a real true diagnostic test is going to be the food challenge. And food challenges are time consuming, they can be risky, they can be anxiety provoking. So there's a lot of reasons not to do food challenges, and that's the reason why I think a lot of allergists and patients are really frustrated, because there's a lot of reasons not to, and you really need to find an allergist that looks for the reasons to food challenge. And I feel like everybody practices differently, but I know that we do tons of food challenges, and the reason why we do is because we're always looking at the bright side, trying to say we're hoping that you're not going to have a food allergy, and the blood test and skin test and your history points to the likelihood is low that you're going to, or maybe it's kind of like in between, it's a toss of a coin. So let's do the food challenge if you're willing to. We're set up for any kind of reaction. We know how to treat anaphylaxis. We know how to treat any kind of allergic reaction. We're set up for that. And so we do a lot more food challenges than I didn't even realize, because I worked at Stanford for 6 years. And so I'm used to doing like 8 to 10 food challenges in a day. And I get out and I talk to other allergists, and I realize that they do like 1 a week, 2 a month. And
it really depends on the practice.
Crazy.
I mean, I think there's some allergists that are much more comfortable doing food challenges, but I think it's that story, it's the patient, it's the person sitting in front of you, and what reactions have they had, or had they not had any reactions. And I think we owe it to them to give them a definitive answer on, yes, based on the testing and your challenge and everything, you're allergic, but we can treat that, we can help so that you can go out to eat, you can live life and not worry that you're going to have a reaction, or have much less worry, because we can do things to treat it now, which is exciting